Americans are getting heavier, and the statistics support that. 69% of adults are overweight or obese, according to the National Health and Nutrition Examination surveys. Obesity is linked to increased risk of heart disease, type 2 diabetes, high blood pressure, certain cancers, and other chronic conditions. For the people who battle what's become a national epidemic, weight loss plans and multiple diets can't compete with fast foods, a more sedentary lifestyle, and a more stressful social pace.
I have tried everything under the sun. I've tried diet pills. I've went to my doctor for years, for about the past 11 years, going to different doctors, trying different diets, and everything's just, it works for a while and then it comes back, if not more comes back, and just doesn't work.
At Spartanburg Medical Center, Medical Group of the Carolinas Weight Loss Services offers a comprehensive multidisciplinary program for both surgical and medical treatments for morbid obesity. Patients can find preoperative, postoperative classes, and support groups that give them the answers they need.
I need the surgery because I have so many illnesses. You know, I have fibromyalgia, I have rheumatoid arthritis, and I have all other numerous diseases and things. And I need to lose the weight really bad because, you know, my doctors told me, if you don't lose it, you're going to leave here. And you want to be here for your kids and your grandkids. And so that's what motivate me into getting into this program, because I definitely need the surgery. I need to lose the weight.
It's the need for a surgical solution that sends many people to Medical Group of the Carolinas Weight Loss Services. A solution to weight loss that will give them their lives back.
Yeah, I've always been heavy ever since I can remember, and I've struggled over the last 10 to 15 years losing weight and gaining weight and then losing it and gaining, and I finally just got frustrated with it and said enough is enough. Well, I had a lot of medical issues. I had diabetes, and I had to take 2 pills a day to keep that under control. And I was on blood pressure medicine. My ankles hurt a lot, and I'd have what they call startup pain. Whenever I sat for a few minutes, I would stand up and my ankles would just hurt. It would take 3 or 4 steps before they would quit hurting. And it was just miserable to carry around that much weight. Dr. Johnson had talked to me about the sleeve, and he had done hundreds of them while he was serving in the military. And he thought that that would be a good option for me. There's a lot of steps you have to go through before to be approved for the weight loss surgery. And in one of the meetings we had, one of the sayings was, nothing tastes as good as skinny feels. And that is really true. I am excited to get, oh, John, you look so good. Man, you are really, really looking good today. You know, your health is good and you're slimming down and everything. That makes, you know, you feel good for people to compliment you like that. And so that's been really nice. I got to the point in my life where I had to do something about my weight. I mean, it was stopping the quality of my life. And now the quality of my life has immensely improved. I mean, it's unreal the things I can do now versus the things I couldn't do, and how good I feel.
First of all, just realizing that you're overweight is huge, but then when you do finally face it and you realize you're more than overweight, but you're morbidly obese, very, very overweight, it was not long before I realized that all the medical problems that I was having were due to the weight. I had hypertension, high blood pressure. I was on 2 medications for that. I had type 2 diabetes. I was on 2 medications for that also. I was soon to be put on a 3rd one, but that's part of what made me realize, wait a minute, what else can I do about this? I had chronic joint pain from my hips to my knees to my ankles. My ankles would swell. I could not walk very long because of the size of my legs. I had it done March 19th of 2003. And the first 2 years, it's great, it's easy. I think they call it a honeymoon phase where you just lose the weight, you know, no matter what. But the work comes after that because your body adjusts to the surgery and you have to maintain. And I remember when I first went and talked to the doctor about having it, he was very honest with me. He said, you're a candidate. This will probably work for you, but it's going to take a lot of compliance after surgery on your part for long-term success. So I'm in my late 50s now, and no more diabetes. I've not taken any medication for it since the day before my surgery. No chronic joint pain. I feel wonderful. I feel really glad that I took the opportunity to do this for myself so that I could enjoy these years. I was angry because I wasn't feeling good, and I was in denial of why I wasn't feeling so good. And for me, obesity stole my self-esteem. So I have that back too, which is nice.
When we come back, a look inside the operating room as we see how weight loss surgeons give obese patients a chance at a better life.
The weight loss can be amazing. For patients who have gone through weight loss surgery, it's common to hear stories of 80 or 100 or even more pounds melting off within months. The decision to undergo weight loss surgery may not be an easy one, but the end results? Dramatically better health? Getting back to an active life? Makes the decision worthwhile. At Medical Group of the Carolinas, Weight Loss Services, our weight loss program is designed to help patients through the process, one step at a time, and to make sure the weight loss procedure fits the patient.
So the way that we choose about which procedure is right for each individual is it takes a consultation with my partner, Dr. Ross, or myself, and we go over the medical history, and some of the history would point us in one procedure versus the other.
With its highly trained bariatric surgery physicians and staff, Spartanburg Medical Center maintains accreditation by the Metabolic and Bariatric Surgery Accreditation Quality Improvement Program as a fully accredited comprehensive center for weight loss surgery. Here at Spartanburg Medical Center, patients are offered a wide range of weight loss surgical procedures. In addition, our surgeons have extensive experience performing revisions for patients who have had previous weight loss surgeries.
For patients who are considering weight loss surgery or metabolic bariatric surgery, we look for patients whose body mass index is anywhere 35 or higher. If they don't have high blood pressure or diabetes or sleep apnea, then their BMI has to be 40 or above. If a person has diabetes, high blood pressure, or sleep apnea, or a combination of those medical problems, their BMI can actually be as low as 35, and they can be considered candidates for surgery.
There are certain medical problems that we look at that would sort of guide us towards one procedure over the other, such as if somebody has really bad diabetes, we tend to lean towards the gastric bypass because the newer studies coming out state that the remission rate of diabetes after gastric bypass is as high as 80% at 5 years.
One of the most common weight loss surgical procedures offered is gastric bypass surgery. In this procedure, the surgeon creates a small pouch about the size of a walnut. It holds only about 1 ounce of food. Because of this, you will eat less and lose weight. The pouch is then surgically attached to the small intestine, bypassing the rest of the stomach and upper portion of the small intestine. The food you eat will now travel from the pouch into your small intestine. As a result, your body will absorb fewer calories.
The gastric bypass is great because it causes a lot of hormonal changes within the body. And we oftentimes have patients come to us that are on multiple diabetic medications, and they will actually leave the hospital on no diabetic medications.
Another weight loss surgery option is the sleeve gastrectomy, where 3/4 of the stomach is removed and surgeons make a tubular structure that allows the food to pass through. The part of the stomach that controls hunger is completely removed from the body.
A lot of patients who would have gastric bypass may also consider having a sleeve gastrectomy done. It does have some of the metabolic effects, and it does help improve diabetes and high blood pressure, hypercholesterol, those sort of things sooner, but in my opinion, not exactly the way we see with gastric bypass.
Another minimally invasive option is the laparoscopic adjustable gastric band. In this procedure, an adjustable band is placed around the very upper part of the stomach, just below the esophagus. Over the course of a year or two, the band is tightened and restricts the amount of food your stomach can hold and how much you can eat at one time. Patients typically lose about 45 to 55% of their excess body weight.
So if somebody comes in and let's say that they're not a candidate for surgical weight loss because their weight is not to that point, we have a medical weight loss arm in our practice in which we put people into a medical weight loss that's supervised by our nurse practitioners as well as our dietitian, So we have something for patients that would qualify for surgery, as well as patients that may not be quite to the point of needing to have surgery yet.
So to have a successful weight loss surgical program or metabolic and weight loss surgery program, you have to have all aspects of a program, which is not just an operating room and a surgeon to do the operations. You know, our patients generally see us anywhere from 3 to 7 months for medical weight management, counseling, psychological evaluation, and therapy classes to go along with that, as well as oftentimes being evaluated by cardiologists or pulmonary specialists, which are heart and lung doctors, to make sure patients are safe for surgery.
At Medical Group of the Carolinas Weight Loss Services, there are full-time dietitians and nurse practitioners who spend months working and counseling with the patients both before and after surgery to help them understand that surgery is just a tool. It's not a cure. It's lifestyle changes and a lifetime commitment to those changes where the success comes in. So even with the different surgical options available, patients can regain weight if they're not careful about what they're eating and drinking or staying active.
So for me personally, it's when patients come and give me a big hug around the neck and say, thanks for giving me my life back. Thanks for allowing me to be able to do things with my kids.
It's very common for us to have patients that maybe weigh 3, 4, even 500 pounds, and they'll come into the office after losing 150 or 200 pounds, and they're swimming, they're running marathons, and before they could barely walk. And that's the driving force behind what we do.
I'm a beautiful person inside out. I just know I'm going to be a better person for my family, for myself, and live life longer, happier, healthier, and be an example to the rest of my family that they can do it too.
Compassionate quality care, advanced surgical options, weight loss experts working together to improve the overall quality of life for patients and their families. To find out how weight loss surgery may be right for you, call Medical Group of the Carolinas Weight Loss Services at 864-560-7070.